getting my smile perfected, and it's actually not my smile, I actually had my teeth reconstructed, was huge actually. As far as confidence, I was just starting to hide my teeth. What it's done, and what I know it's done, is it makes me look at least 10 years younger. Because as I see my other friends at the same age group, and they're aging and their teeth are yellowing and yellowing and yellowing, and mine don't. They don't yellow at all. And yet I will have them forever. And so it's really nice to know that my teeth aren't going to change and that they're solid, and so it makes me look younger, which I know it does, and it just has a more professional look. Like it's more polished, that I care for myself. It's clean, and it's when I've traveled to third world countries, you can tell how wealthy a country is by the dentistry, by how well people take care of their teeth. So it's certainly a sense of affluence in that sense. So does it give confidence? Absolutely. And I would have to say, without it, it's a huge difference. Huge. So what brought me to cosmetic dentistry actually was kind of a lifelong process. I was born with super thin enamel, and so my enamel was such that it was wearing over time. And by the time I was 40, it became very clear that I was going to need to do something about my teeth, that the enamel was wearing. And with that, I could not use, I was seeing the dentist quite often. I was very on top of my teeth. I could not use an electric toothbrush. And I knew that at some point I would need a reconstruction. As I got closer to 50, it was very clear to me that my integrity of my teeth were failing. And if the teeth were to start cracking, I would require that I get implants. And I was told by the dental surgeons that I work with that for me to do it while my teeth were still intact was critical, rather than wait until I started having problems. So I was very proactive on getting this done. So I actually shopped around from what I understood and looked who was best in the industry, and actually was set up with a dentist in Newport. And then my favorite jeweler in Catalina, in Avalon, actually sold his business, and it was purchased by John Hopt. And I received a little postcard with the jewelry saying that it was a 30% discount. And so intrigued, I had to go see this jewelry and see what he had. And he kept it at his lab because that's where he had his safe. And so as I went to his lab and I got to see them making dental reconstruction, making teeth, I was like, well, this is interesting because I'm going to have a reconstruction, only we're only could afford like 6 in the front and 6 in the bottom. And so he mentioned the American Academy of Cosmetic Dentistry, and I hadn't heard of it. It was kind of like, well, don't know what that is. But so I looked it up, and it was very interesting to find that there was a whole association with that and with different levels of specialty. So I actually was able to see one of the dentists that John worked with locally. He did an evaluation and assessment, and so I had seen one, and so I had 7 others that I went to and interviewed and got their input on it. And so Dr. Burney was on one of my lists because he's accredited. And when I went to his office, what stood out for me the most was that he took pictures, but not only did he showed me things that I hadn't seen before. I had some cracks and some fillings that I didn't even know about. And so the thoroughness and the level of expertise was very evident to me. The other aspect was just the enthusiasm. Dr. Burney was willing to work with John Hopt, doing the ceramic work. And it was just this whole sense of, it was a big project because we did all my teeth. It was a full mouth restoration. And because of my primary problem being with the thin enamel, I really felt that a full mouth restoration is really what I needed. Every tooth really needed to be structurally reinforced in order to keep them. And so we embarked on this journey, and it's been 5 years come April 1st. And it pretty much was an amazing process. It was definitely worth doing, and it's been kind of exciting to have that done. Well, my experience is the staff is very personable. They know you well. You're warmly received. The workflow for the office is very easy, very smooth. There's not long waits, and your concerns are taken very personally. Every time I've been in, it's been something that you almost don't even think about because it's just so expertise. It's just such a a warm experience. Well, cosmetic dentistry, it's a big undertaking and it's a serious undertaking, and I highly recommend Dr. Bernie in that I worked with him extensively as far as my reconstruction. We were a full mouth reconstruction is quite a few hours, and I've had extensive dental work all my life because of my amniogenesis imperfecta, so I know someone with good hands, and Dr. Bernie's hands are excellent. We did do repeated blocks, and just his hand skills are top notch. So knowing that and having the background that I've had with a lot of experience, I'm very, very comfortable with that. I think, it's a certain amount of work you need to do, and to be honest with you, now that my teeth I've had a restoration, I don't expect I'll ever need a major dental procedure again, probably the rest of my life. They're so well preserved and intact that basically I'm kind of done. And so yeah, there is that initial investment of having the work done, but afterwards the results are just so profound, and then just the longevity of the results is really significant. I'm 5 years out and it hardly shows any change, and I expect to have this probably for another 40 years, maybe more, and all I do is cleanings, and so that's huge. The level of expertise with Dr. Bernie is also impressive in that because I was a full mouth, it was just the lineup, and then it was like the variability from side to side, and then how the jaw matched, and then how the teeth matched, and how your bite works. And it's just amazing. I have sharp teeth now too. That's the other thing. So, takes a little adjusting to that, but mine, I primarily came for structural improvement because I did not want implants, and I had to protect my teeth. Cosmetically was huge, and that was just a side benefit. So it's definitely the return on your investment. It's definitely an investment. It's an investment in your time, it's an investment in your money, it's an investment in the discomfort of having a dental procedure, but the return on your investment is huge, and that really pays off. I definitely, to get 40 years of service for the crowns I have, that's just huge.